But just one other point too, when we talked about the red blood cells. So I told you how we can actually absorb the phytosterols, the fake plant cholesterol, about 1%. And in actual fact, one of the best tissues to look at these is our red blood cells, and we can actually see them get incorporated into the red blood cell membrane. And there's very good evidence that the level of plant sterols within red blood cells directly contributes to their fragility, e.g. they burst and they die early. And this is one reason. So you would have heard of people who they say, well, their blood sugar goes up on a carnivore diet. Often what we call the HbA1c, which is a measure of blood sugar, will often go incredibly high on a carnivore diet. And removing the plant sterols from the diet is actually the cause of that. So let's think about what HbA1c is. Everybody gets bent out of shape. I actually think the more I use it, and I think I use it more than most people, the more I understand it has significant limitation. So you get a red blood cell. It's swimming around in a soup of glucose. So we have something called non-enzymatic glycation, where the glucose molecule will just passively attach to the red blood cell. So the more glucose there is in your blood, the more glucose molecules will attach to the red blood cell. And then we measure that as HbA1c. But that's not the full story. So the concentration of sugar is not the only metric affecting this. So you've got what we call glycation inhibitors, which I won't bore you with the details of, but there's molecules like carnosine, and duration. So the longer that red blood cell is put in that soup, then the more sugar molecules will attach. If you put it in there for 2 minutes, nary a molecule will grab onto it. If you put it in there for 2 years, it's going to look like sugar. So if your red blood cells have got these plant sterols in them, then they're very fragile and they're bursting all the time, then they're not going to be very old. So the average age of your red blood cells is going to be quite short. So your HbA1c is going to be artificially lowered. What happens if you rip out all of these plant sterols from your diet and your red blood cells over time, they get healthier? They're going to live longer. So they're going to sit in this soup of sugar for a much longer period of time. In that situation, your HbA1c is not going to be proportional to your fasting blood sugar level or your average blood sugar level. It's going to be much higher. And that's simply because your red blood cells are healthier and they can live for longer. And we can prove this, and I do prove it in my patients. You would have heard of reticulocytes. Mm-hmm. It's a term for a new red blood cell. So basically, when a blood cell is first formed, it has a little bit of RNA in it. It's a little bit bigger and it's a little bit purplish. It's a reticulocyte, looks different to more mature red blood cells. So we can actually get a sense for how many new red blood cells your body is producing by looking at the number of reticulocytes. If you're having a lot of seed oils that are leading to very fragile red blood cells, then your body's going to have to produce a lot of new red blood cells to replace the ones that are dying prematurely. So you'll have a high reticulocyte count. Whereas when you go on a carnivore diet, if we do a consecutive measurement of your reticulocytes, we'll see that even when your red cell count, the number of red blood cells you're having is staying stable, your reticulocyte count, the number of new red blood cells will be falling. And we can directly infer from that your red blood cells are living longer. And coincident with that, we'll see this elevated HbA1c, which bears no resemblance to reality of your actual blood glucose levels. So if patients are concerned, I'll often get them to use a continuous glucose monitor, and we can demonstrate they'll have pancake flat blood glucose levels while their HbA1c is high. That's just a marker of improved red blood cell lifespan.
Yeah. I often wondered about that. I sort of theorized that that probably would, that your red blood cells would likely live longer just because all your cells are going to be healthier. And as such, you would be exposed to glycation longer, and that you would have that high. So that's great that's what you're actually seeing in the lab work.
Yeah, and because I know reticulocytes isn't a standard blood test, but I find it invaluable for that, because if you've got oxidative stress in your body, then your red blood cells are going to die earlier. So monitoring reticulocytes is one of those things that I like to do.
Yeah, interesting.